अप्रैल फूल्स डे इज ऑल अबाउट प्रैंक्स एंड फन, लेकिन क्या पता अगर आपका ये कोलेस्ट्रॉल भी आपको साइलेंटली फूल कर रहा हो। ये जो इंक्रीज्ड लेवल्स ऑफ कोलेस्ट्रॉल है, ये बिना किसी वार्निंग के आपके हार्ट के हेल्थ को रिस्क में डाल सकते हैं। जस्ट बिकॉज यू फील फाइन डजंट मीन दैट एवरीथिंग इज फाइन। नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल, वेयर हेल्थ मीट्स कन्वर्सेशन. I am your host Dr. Chetna, and in today's episode we will be talking about cholesterol and understand what is LDL, HDL, and most importantly why low is better when it comes to lipids. So to simplify this and make us understand this better, joining us today is Dr. Joy Shome. He is a senior consultant cardiologist and the head of TAVR and TAVI implantation at BM Birla Heart Hospital, Kolkata. He has returned to India after spending 18 years in UK. So let us learn more and hear from Dr. Joy Shome. So firstly, hello doctor, and thanks a lot for coming to our show today, which is Beyond the Pill. And it's an absolute honor to have you with us today.
Thank you, Dr. Chetna. It's a privilege is mine, and I'm very happy to be on this show hosted by you and by Mankind. So thank you very much.
So I was just going through your CV and I read that you have spent like 18 years in UK. So how was your experience there?
Yes, I did spend a long time there. I studied medicine in India, but after that I moved to the UK and I did all my postgraduate training there.
Okay.
Finally specializing in interventional cardiology, and then as a family, we just decided to move back to India recently.
Okay. So as a specialization, why cardiology? Why did you decide to get into this field?
I actually always wanted to be a heart surgeon,
Okay.
funnily enough. But my father is a surgeon, and I was always fascinated by the heart. But somehow, whenever I wanted to get into surgery, things weren't clicking.
Okay.
And at the same time, I happened to get entry into medicine, general medicine. And I remember that I was hearing about angioplasty and basically treating the same disease in a different way.
Okay.
So rather than cutting open the chest, treating the disease by passing wires inside the blood vessels, and that really sort of appealed to me.
Okay.
The very minimally invasive nature of this profession, of this craft. And I thought, well, I'm treating the same problem, but in a different way.
That was just that
And
direction
so I guess,
was your calling actually.
yes, I think, just life events and, sort of, when one door closes, another opens, that kind of a situation. And here we are.
So now that you've practiced in UK and as well you're practicing in India, so what is the difference, I mean, you see in especially when it comes to awareness about cholesterol or heart health?
I think one of the main sort of standout points that I see is that heart disease is affecting us Indians at a very early age.
Absolutely.
I did not see this in the UK. So
Absolutely.
in the UK, our patients would be in their sort of, late 40s, early 50s. But we are seeing so many patients here in our country, unfortunately, in the late, 20s even, and 30s is just normal, To see a patient come in with a heart attack in the 30s is sort of normal, which actually is not normal.
It's surprising. Yeah.
Yes, so that is, I was really taken aback, in my first few months after having come back, how serious the problem is, because these are young people who've got their entire lives in front of them, and if they're affected by serious cardiovascular disease, for example, a heart attack, it has enormous consequences, on the patient, on their
That's true,
family,
that's
on
true.
their economics.
That's absolutely
So,
right.
so this is something that I was really startled to find, and I'd heard of it, but when I actually experienced it, it was not very nice.
So what could be the reasons behind it? What do you think, that why does even the younger population is getting affected now?
I think, talking about, cardiovascular disease is a complex interplay of several factors. So one of them is obviously genetics. We inherit genes. So there are families in which there is a history of heart disease. So there is a possibility that members of that family
Correct.
can sort of, have the same problem. The other is certain risk factors, for example, being males are sort of
More prone to it,
preferentially
yeah.
more affected, being middle aged, or in India, maybe 10 years younger compared to the Caucasian population. And then finally, lifestyle factors, such as, you have a bad diet, lack of exercise, stress. And then you have the conventional risk factors like high blood pressure, diabetes, high cholesterol. India has probably, one of the highest number of diabetes patients in the world. So all of these come, sort of, when they put them together, they have formed this ideal, mix for cardiovascular disease.
So what do you think the population who has diabetes or hypertension are also more susceptible to get cholesterol?
Yes and no, not necessarily I would say hypertension, but in diabetes, a lot of people carry
Thyroid,
fat,
yeah.
and therefore by virtue of being overweight, by virtue of having sort of more fat, by virtue of sort of more sedentary lifestyle, these are all factors that impact cholesterol.
Okay, so looking at only lipids point of view, so in our population, I feel that people mostly just know कि cholesterol है, and it is a term which is bad for your body. So this is a reputation which is been made, I mean, in our population. So what do you have to say about it? Like कि cholesterol का main function body में क्या है, and क्यों लोग इसको इतना गलत interpret कर रहे हैं?
तो देखिए, कोलेस्ट्रॉल जो है, इट्स अ सब्सटेंस इन द बॉडी, इट्स एन एसेंशियल सब्सटेंस. तो इन द बॉडी कोलेस्ट्रॉल इज यूज्ड फॉर बिल्डिंग ऑफ सेल्स. तो सेल्स में जो सेल मेम्ब्रेन्स होते हैं, उसमें कोलेस्ट्रॉल होता है. देन in the making of vitamin D, in the making of many hormones, cholesterol की जरूरत है. So actually cholesterol is a waxy substance which is needed for sort of bodily, for the functioning of the body. लेकिन क्या होता है कि when there is an excess of cholesterol, then some of this can deposit in the walls of the blood vessels. जो हमारे बॉडी के अंदर जो ऑर्गन्स हैं, उनमें जो ब्लड वेसल्स, फॉर एग्जांपल हार्ट के जो आर्टरीज हैं, जो कॉर्नरी आर्टरीज हम बोलते हैं, जहाँ हार्ट अटैक्स होते हैं, तो उस कॉर्नरी आर्टरीज के वॉल्स में कोलेस्ट्रॉल डिपोजिशन हो सकता है, गले के आर्टरीज में हो सकता है, पैरों के आर्टरीज में हो सकता है. तो यहाँ पे जब कोलेस्ट्रॉल बिल्डअप होता है, फिर वो आर्टरीज में नैरोइंग होता है, आर्टरीज में जो हम ब्लॉकेजेस कहते हैं.
करेक्ट.
एंड दैट कैन देन लीड टू हार्ट अटैक्स, events such as heart attacks, or a condition such as angina, jahan pe there is a blockage and therefore a person cannot walk or exert normally. So that is where then cholesterol becomes a problem.
So there are a lot of myths which is being circulated around about what exactly is good cholesterol and what is bad cholesterol. So could you help us burst some of them?
Yes, so thank you. I think cholesterol is something that cannot travel in the blood on its own. It's a bit like unko ek car ya bike chahiye to go from one place to the other. So there's a substance called lipoproteins. So lipoproteins are proteins that carry cholesterol basically. जो cholesterol जो हमारी body में होता है, majority of it actually does not come from the diet. It's actually manufactured in the liver.
Okay.
So and from the liver it then travels to various parts of the body. So ये जो lipoproteins हैं that carry cholesterol, so there are basically several types, but the main ones that are important are, एक है low density lipoprotein जो LDL हम बोलते हैं. Now इसको अक्सर bad cholesterol कहा जाता है. LDL is often called bad cholesterol, and the reason for that is that this is the one that leads to build up. This is the one that tends to build up in the walls of the arteries and causes the blockages and the heart attacks, etc. एक और है जो हम कहते हैं high density lipoprotein, HDL. That is also called that is actually good cholesterol because it has some protective effects on the body. So these are the main ones. So the ones that we worry about the most is this thing called low density lipoprotein or LDL wala jo cholesterol component hai. We worry about that. And then besides that, there are triglycerides. Is the other one that we often diet se bhi बढ़ जाता है, and that can also then lead to overall high cholesterol levels.
सो जस्ट नाउ यू मेंशनड कि ज़्यादातर जो ये कोलेस्ट्रॉल है वो डाइट पे डिपेंडेंट नहीं है, लाइक द मेजर परसेंटेज इज नॉट डिपेंडेंट ऑन डाइट. सो व्हाई इज इट दैट वे कि लाइफस्टाइल चेंजेस से कोलेस्ट्रॉल मैनेज किया जा सकता है? देन हाउ डज इट मेक सेंस देन?
नहीं, डाइट इज इम्पोर्टेंट. फॉर एग्जांपल कि जो फैट है, बिकॉज अल्टीमेटली यू नो द फैट इज आवर फैट इंटेक इज वेरी इंपॉर्टेंट. सो हमें जो फैट्स लेने चाहिए और नहीं लेने चाहिए, सो द वंस दैट वी शुड नॉट टेक इज सैचुरेटेड फैट.
राइट.
क्योंकि those that is where it can lead to an increased LDL level. So saturated fat such as आपका जो what is found in red meat, what is found in dairy, full fat dairy products, etc. And then जो और भी dangerous है वो है trans fats.
Yes.
So trans fats जो है, again these also contribute to increasing the LDL levels.
Okay.
And trans fats are those जो partially hydrogenated oil से आते हैं.
Okay. Okay.
And these are cheap oils. So the oil, it is cheap to manufacture, so it is widely used.
Yeah.
And it is toxic to the body.
Okay.
And a lot of deep fried foods
And
are
again
made
and
from these
again
oils.
using the same
Correct.
oil.
The
Yes.
same oil is being used again and again. And जैसे आप cookies हो, so low quality bread, cakes,
Okay.
food like that. I'm not saying we shouldn't eat it, but we should keep an eye कि क्या खाना है और कितना खाना है.
Right.
And so these are the two food components again which have a role to play in sort of जो हमारा जो lipid balance है उसको alter करने में towards the sort of bad part.
Okay. So जैसे अभी हम डाइट की बात कर रहे हैं, so is it like all the obese patients will eventually develop increased level of cholesterol in the body?
I think it's a risk factor. So like I say, anything is a complex interplay between genetics, lifestyle, the person, what that particular person's response is जो है. तो obviously obesity will increase the risk, but that does not mean कि जो obese नहीं है उनमें cholesterol high नहीं हो
Right.
सकता.
Even they are more prone. They
Yes.
are also prone to heart attacks, right?
Yes. So हमें अक्सर एक misconception होता है कि I am not fat, I am not obese,
Yeah,
so
yeah.
I'm okay.
I'm healthy, right?
Yes, but that is actually a fallacy.
Yeah.
Because high cholesterol levels का कोई sign या symptom नहीं है.
I feel that is the saddest part of it कि उसके symptoms ही नहीं हैं. So फिर कैसे, I mean, how would someone understand that I am developing the levels are increasing day by day? So how to help them with this?
I think that is probably the single most important question you've asked, and I think कि because इनके कोई sign or symptoms नहीं है, there is one condition called familial hypercholesterolemia.
Understood. Yeah.
That is rare, but it's a genetic condition.
But that is something which we cannot actually modify and.
Yes. तो उसमें क्या होता है कि उस particular family में, it's a genetic condition, so it's passed on to the members of the family. We find that the patients have very high cholesterol levels, and क्योंकि उनके cholesterol levels इतने high हैं, they have a very high risk of developing heart disease, vascular disease, heart attacks, so on.
Yes.
अब going along that vein, अब ऐसा है कि जिनमें कोलेस्ट्रॉल ज़्यादा है, क्यों अब familial hypercholesterolemia में you may have some signs. For example, xanthal asthma करके एक sign है. You'll find some people have some yellow deposits near the eyes.
Yes.
But that's rare. But when you see that, that is possibly the only sign, external sign. But that is rare. It's usually in people with very high cholesterol levels, maybe with somebody with familial hypercholesterolemia, FH बोलते हैं हम लोग. But apart from that, actually there are no signs and symptoms. So we may have a person who is otherwise reasonable body mass index, जो obesity का या weight का जो parameter है, obesity का जो parameter है, they may be fine, but they may be harboring very high levels of cholesterol in their blood. So इसके लिए the only way is to check your lipid levels. There is no other way.
But then you just mentioned कि even people who are in 30s are getting heart attacks nowadays, and जिनके cholesterol levels भी high होते हैं कभी-कभी. And what we think कि screening ज़रूरी है after 40s. So then ये जो population है ये कहाँ जाएगा, क्या करेगा then?
Exactly. So actually अगर आप देखें, there are national societies and certain national societies with guidelines, उनके prescribed guidelines हैं. तो एक्चुअली कोलेस्ट्रॉल जो है वो हर एक इंसान की ज़िंदगी में उसका मेजरमेंट होना चाहिए. So the official recommendation is that even in children it should be measured, once between the age of 9 to 11.
Okay.
In sort of late teens to early adults, it should be measured once between the age of 17 to 20 roughly. And definitely in adults above the age of 45, it should be measured every year. In women above the age of, sort of premenopausal women, once they've attained menopause or after 55, it should be measured yearly. So for men above 45, women above 55.
Okay.
लेकिन इसके पहले भी, between sort of early adulthood to middle age, 45, whatever, cholesterol should be checked between every, at least I would say 5 years or so. ताकि एक पिकअप तो हो, एक पता तो चले, कि what's happening, and then appropriate measures can then be, initiated.
Right, sir. So I feel that it's important to have the self-awareness that I am consuming a lot of junk, lot of sugary products. I am taking alcohol, I'm smoking. So there could be chances कि मेरे cholesterol level ऊपर नीचे हो.
Yes.
And in this people, मतलब थोड़ा voluntarily जाके cholesterol या फिर just lipid levels you should check.
Yes, I mean, we are living a 24/7 lifestyle nowadays. We are sort of catching the 5 a.m. Indigo flight, and then we are doing our job, then the dinner, and then late night party. So there's no time for the body to recover. And then
absolutely,
back at work the next day.
Yes.
So in this sort of fast-paced life, as you have mentioned, everything takes a toll. So आज हमने जो preventative measure ignore किया है, that is getting sort of left by the wayside.
Yes.
But eventually it all starts to build up. So having that awareness is like an insurance for yourself, I would say.
Correct.
It's absolutely like an insurance. It's like, I always tell my patients who come in with heart attacks, that, sir, your artery was blocked, मैंने stent डाल दिया है, artery is open, you're feeling good. But you know what I have done? I have firefighted today. This is firefighting. I have put out the fire.
Yes.
Yes. So as you asked me just a little while ago, I treat patients with heart attacks. They come with heart attacks. I put a stent in, and then they're feeling okay. One moment they're crying out in pain. You put the stent in. Next moment they're feeling okay. उनको पता है कुछ हुआ ही नहीं. And I always tell these patients that, look, sir or madam, ये जो हुआ है, we have done firefighting today. तो आग लग गई है, हमने आग बुझाया आज.
Right.
But what we have to concentrate on is ये जो spark है जिससे ये आग शुरू हो रहा है, that is where we have to concentrate.
Right.
ये आग आए ही नहीं.
Exactly.
This fire should not come in the first place. So that is where cholesterol, monitoring, detecting that, knowing our cholesterol levels, taking measures to address it if it is high, whatever it may be, lifestyle or medication, So that is the process of trying to do our best to prevent these events in the later on.
So this is what we are trying to more talk about or spread awareness about, that prevention is actually the key. So what are the preventive measures that you recommend to your patients with heart attack especially, and also for the patients who have high cholesterol levels and they should not get heart attack?
So generally I usually say, we see two kinds of patients. So one is somebody who has not had any cardiovascular event as yet. तो उनको कुछ हुआ नहीं है, heart attack, stroke या कुछ ऐसा कुछ हुआ नहीं है. So they are well, So they उनको वो आए हैं एक checkup के लिए, or maybe because there is a family history or something. So in them we always say कि आप आपके जो lipid levels हैं, आप एक lipid profile कीजिए. Fasting lipid profile is a test that we ask them to do. और उसका ये वजह है कि triglycerides जो component है of the lipid profile, if you eat and come, then the triglyceride levels will be high. So so a fasting lipid level will give you the ideal triglyceride level, in addition to आपका जो LDL है, HDL है, and total cholesterol levels. Now ये जो patient, I won't say patient, this person who has come to my clinic, अब ऐसा भी हो सकता है कि उनका कोई रिस्क फैक्टर नहीं है, दे मे बी लेट्स से 25 और 30 वर्किंग इन द IT इंडस्ट्री, they just want to make sure that सब कुछ ठीक है. So that's great. I like that, and
Yeah.
I find a lot of patients like this coming to my
Nice,
clinic
nice,
nowadays, and
nice.
I really like that awareness.
That's good. Yeah.
It's good to know that somebody is actually thinking and has taken 5 minutes out of their life to actually
Yes.
think that सब ठीक तो है,
And to come to you and do the consultation.
Correct,
Yeah.
correct. So in a person like this, we will check all their sort of parameters, उनका lipid level क्या है. Now then you have the other cohort of patient. Again, उनमें भी कोई event नहीं हुआ है, उनको heart attack या stroke या ऐसा कुछ हुआ नहीं है, but they come in, but they have got some risk factors. For example, they have diabetes, or they have high blood pressure, or something like that. So they have risk factors for heart disease. अब उनमें क्या होता है कि उनमें भी obviously हम check करेंगे, लेकिन उनमें now we are very serious about the control of that, because
yes.
already उनमें एक substrate है, diabetes है, hypertension है. So compared to the first cohort of patients, उनका risk to develop cardiovascular disease is higher.
Okay.
ठीक है. And then you have the third patient who is actually presented to hospital with an event. For example, उनको heart attack हुआ है या angina हुआ है और stroke हुआ है. So the patient has already experienced a cardiovascular event.
Okay.
So अब उनमें again, we want to make sure that in them, we are absolutely, on top of their cholesterol level, so that एक event तो हो गया है, but now we
right.
do our maximum to prevent the second one, which is called secondary prevention.
Yes. Okay.
So this is the approach generally that हम लेते हैं when we assess patients.
Okay. But then what are the preventive steps that you ask them to take, like in all three types of patients?
Yes, so the first thing we would do is, obviously you get your cholesterol level checked. So the total cholesterol should be ideally less than 200. Okay.
Okay.
Then you should have your HDL and LDL. So LDL is the bad cholesterol. So LDL we want levels of less than 100.
Okay.
Okay.
LDL. हाँ.
लेकिन जिनमें हार्ट अटैक हुआ है, स्ट्रोक हुआ है, we want the level to be less than 70. If possible, about 50 to 55. So we are going really hard, on those patients, because हम try करने हैं कि उनका जितना prevention हो सके for the second event वो हो.
Correct.
Now that may not be, lifestyle change may not be enough in these patients. So drug therapy, जो statin therapy है, and other drugs apart from statins or similar to statins we use. Now in the other patients जहाँ पे cholesterol, is maybe slightly high, जिनमें और कोई risk factors नहीं है, then the traditional risk factors जो है हम बोलेंगे, one is exercise. So exercise goes a long way in reducing, there is some evidence that it does help reduce, LDL levels. So doing physical exercise for 30 minutes at least 5 times a week is something that is sort of generally recommended. And exercise मतलब aerobic exercise, ऐसा नहीं कि हम टहल रहे हैं, you either doing a very fast walk, or you're running or swimming or doing some sort of aerobic exercise. Second thing is reducing weight,
Okay.
Third is, keeping an eye on the diet, like eating heart healthy foods. So, reduce your saturated fat, completely eliminate trans fat as much as possible, जो trans fat अभी हमने कहा, have foods that are rich in omega-3 fatty acids, if depending on whether people are vegetarian or non-vegetarian, appropriately, select them. Sleep is very important, we often overlook, because
everything is related
yes,
to sleep,
yes, and then reducing your levels of stress, and so all of these play a part. So and then obviously we are talking about lipids, but it goes without saying that हमें अपना ब्लड शुगर भी चेक करना चाहिए, हाइपरटेंशन जो ब्लड प्रेशर है वो भी चेक करना चाहिए, सो बॉडी मास इंडेक्स जो है वो भी चेक करना चाहिए, all of these other things should also be checked.
So what I understand that cholesterol को जो maintain करना है या manage करना है, it is a collective effort, right? So other than lifestyle changes and diet, what are the treatment options that are available अभी?
देखिए treatment options, the mainstay of cholesterol management of lipid is statins. This is drug called statins. So the statins are a group of medicines, दवाई है जो cholesterol level, especially जो LDL cholesterol है उसको reduce करती है. So with statins, और statins हम जब prescribe करते हैं, we I just mentioned the numbers again. You are looking at a total cholesterol. Ideally, you want to get it down less than 200. आपका जो LDL है, you want it less than 100. And इसके लिए हम statins use करते हैं. अब जिनमें हार्ट अटैक हुआ है या स्ट्रोक हुआ है, especially people with heart attacks, we will give them a high dose statin regardless.
Okay.
Because it also has some plaque stabilization effect. उसका ये मतलब है कि जो blockages होते हैं हार्ट के arteries के अंदर, these blockages अचानक से the lining of that blockage or the lining of that blood vessel actually जिसके नीचे blockage है, that lining suddenly tears.
Okay.
इसकी वजह से अचानक से वो blood clot जमा हो जाता है वहाँ पे. That's why we cannot predict heart attacks कब होंगे. तो this plaque जो है, जो blockage है, ये rupture ना हो या ये उतना problem ना करे, ऐसा blood clotting ना हो, ये जो plaque stabilization बोलते हैं इस process को, just to in sort of simple terms, it's a more complex process than this. तो इसमें again high dose statins have found to be helpful.
Okay.
तो जो patient है जो एक event लेके आया है, heart attack हुआ है या stroke हुआ है, so we will give them, especially in a heart attack, give them high intensity statin. अब there are patients जिनका cholesterol level high है, in them we will obviously give statins.
Yes.
If lifestyle measures are not working, then to make sure that कि जो level appropriate जो level है cholesterol का, so that we achieve those targets.
Okay.
And in this situation, there is also another approach is to calculate their risk. तो एक sort of risk है हम जो calculate कर सकते हैं of cardiovascular disease of a person जिसका अभी कोई problem है नहीं. So but we can, and if their risk is above a certain threshold which is defined by various bodies and guidelines, then also we can start treatment. But the bottom line is कि हमें check करना है.
Screening is important.
Screening check ही नहीं किए तो पता ही नहीं चलेगा.
That is absolutely right. So this cholesterol, the statins जो cholesterol के लिए लेते हैं, वो if you start taking it once, it has to be taken for a long term.
Yes, in general, yes, unless the levels are only borderline.
Okay.
So if the levels are borderline, yes, you may choose कि आप लिए और अगर वो ठीक हो गया, then you can leave. But generally, once you take, if provided patient tolerate कर पा रहा है, then we will continue it. For the longer term.
So
obviously, agar side effects ho ya kuch ho, then
yes, so are there any side effects associated?
Yes, there are side effects. One common side effect is ki people complain of pain in the muscle. So it can cause a bit of inflammation in the muscle. Again, statins, काफी different. There are different different types of statins. Different various. There's a atorvastatin, rosuvastatin. So अगर एक statin से हो रहा है तो इसका ये मतलब नहीं है कि दूसरे statin से भी होगा.
We have options.
We have options, exactly. So we can work around it.
Okay.
And then there are other sort of lipid lowering drugs that we can use. There is a drug called ezetimibe. Then there are drugs called fibrates. So these drugs also help reduce the cholesterol level. And then sometimes we find that just let's say we have a young patient. Is 35 years old. This is real life. Has big heart attack. We've done a stenting. And then हमने देखा कि उनका cholesterol level बहुत high है. So we've given them high dose statin. 40 of rosuvastatin or 80 milligrams of atorvastatin. Given them ezetimibe. And then हम देखते हैं कि 6 महीने बाद भी उनका LDL बहुत high है.
Okay.
So this patient's risk is still high.
Yes,
He's 35 years old. He has just about got away from a life-threatening event. और अभी हमें now we have to very sort of seriously think of reducing the risk. So abhi we have new molecules. One of them is called PCSK9 inhibitor. The name sounds a bit long,
yeah,
but it's actually sort of a anti sort of human monoclonal antibody, and it is used and it is found to be very effective. So it's injection form में दिया जाता है.
Okay.
One of the drawbacks is it's expensive, but again taking everything into consideration.
Yes, I think.
क्योंकि hospitalization has a cost.
Yes.
Let alone
yes.
the life of the person,
yes,
and future
definitely.
events. So these are other things that we follow up. So अगर दवाई से नहीं हो रहा है, statin से नहीं हो रहा है, combination therapy से नहीं हो रहा है, then we will go to the next,
yes.
level of treatment, which may include, these injectable therapies.
So what these patients do है कि जैसे ही cholesterol levels normal आ जाता है, अपने आप से they stop taking the medication, and then again after 3 months they are checking and they see कि cholesterol level बढ़ रहा है अब, then they'll start taking the medication again. So how much bad is this practice?
Yes, It's a bit like I always think कि आप आप एक school में हो and normally a classroom has to have a certain attendance, right?
Yes.
You have to have minimum 85-90% attendance, नहीं तो इसका भी वैसे ही है, like you want to get to the next class with a with a good record, so too for your own health, you want to be persistent, तो आपको वो continuously लेना है, एक दिन स्कूल गए दूसरे दिन स्कूल नहीं गए, उस टाइप से तो होता नहीं है. Similarly for the body. So I think you're absolutely right कि one of the main problems with cardiovascular disease today is that you see जो हमारे जो treatments हैं वो इतने effective हो गए हैं,
Yes.
that you feel well,
Yes.
and you think
Yes.
मुझे जरूरत नहीं है,
Right. हाँ.
I don't need a cholesterol medication, I don't need to take my blood thinning medication.
Right.
So these are real problems because I have seen patients come back with a blocked stent.
Yes.
because उन्होंने लिया नहीं अपना दवाई, बोला मैं क्यों लूँ, मेरे तो अच्छा लग रहा था, ठीक लग रहा था,
यही
2-3 दिन बाद
यही message I want. So a message that I want to pass from this conversation is that कि it is important to consult your doctor and also to do the screening regularly. Like if you have cholesterol or if you don't have cholesterol, it is important कि हम screening करवाएं, right? I mean, I feel that even family, maybe if people sit together, they will talk about good and bad about cholesterol, but then उसका checkup क्यों important है और क्योंकि वो एक बिना warning sign के है. So I don't feel that people know the importance of getting and screening done.
I don't think you could have emphasized it better. Let me give you an example. मैं जब UK में था, it is not that easy to get blood tests done.
Okay.
आपको अपने GP के पास जाना है, appointment लेना है, when they are free, you are free. But in India,
Yes.
there are dozens and dozens and God knows how many hundreds of labs. आपने just उनको phone करना है एक बार, they will come home and take your blood.
Yes.
This is how easy it is. I was really amazed कि how easy
Yes.
things are in our country as well, and we should be proud of it. But इसका अगर हम फायदा नहीं उठा रहे हैं, then
it's a bad thing,
it's a double jeopardy.
Yes.
So I think screening is absolutely paramount because, as I had just mentioned, बिना blood test किए हमें पता नहीं होगा कि हमारा जो cholesterol level है वो है कि नहीं.
Correct.
So the only way to know, because there is no sign, there is no symptom, and we should not wait for the first heart attack to be the alarm bell.
Yes.
कि अभी ये test होना है. By the time the boat has left.
Yeah.
So screening is paramount. वो करना चाहिए at the earliest. All it takes is just find a good lab or consult your family doctor, your GP or whoever it is who can prescribe you the medication, or even yourself, go and just get your lipid profile done.
Yes, that is
It's as easy as that.
That is true.
And sometimes when I see the patients जो reports ले आते हैं, मैं देखता हूँ, sometimes the reports are so good, they actually give the risk brackets also in the report. हर एक report में risk bracket भी है.
Yes, nowadays तो yes.
Greater than ये है तो इतना है risk आपका, so somebody, you don't even need to be a doctor, you don't even need to be in the medical profession. आपको, that information, any
good enough,
a smart Indian person, man or woman is intelligent enough to understand कि, this is not right. Chalo, let's see a doctor and let's do something about it.
Correct.
But only when we, find out that is the case. So doing that screening, doing that blood test, if there's one thing that we take away from this conversation today is get your lipid profile done.
That is very important.
If it has not been done,
that is.
So I think that is a single most important, I think, message that can be given, for all of us.
Yeah, just don't wait for the body to give you an attack.
Yes.
And then
Yes.
go for the
Yes,
screening.
absolutely.
Yeah, that's right. So, what do you think? Like, lastly, how this cholesterol as well affects the quality of life of a person?
You see, cholesterol is actually one of the good things about cholesterol is that it's actually well managed with medication. So if you अगर किसी को high cholesterol है and they are taking their statins, for example, and they are able to tolerate it, that's all that is needed.
Yes.
So for no extra, discomfort, they are getting a reduction in their risk of developing cardiovascular diseases. ऐसा तो नहीं कुछ उनको तकलीफ हो रहा है, they're just taking the medication. The medication is doing the job it's meant to do. the levels are reducing, and as a result, उनका जो overall cardiovascular risk or the risk of developing cardiovascular events such as a heart attack or stroke वो कम हो जा रहा है.
That is right. That is right.
So so that is great, and that is one of the good things that कि कोई extra effort नहीं देना पड़ रहा है apart from checking the cholesterol and then acting on it. That may be lifestyle.
Yeah, just a support by doing regular screening and some lifestyle changes.
Absolutely.
Also, ज़्यादातर ऐसे हमारे देश में बोलते हैं कि men are more susceptible to get heart attacks and as well cholesterol. So what do you think about it? Is it true that women doesn't get this cholesterol and men it is more commonly seen in men?
No, you're right in the sense that जो women में क्या है, there is some protective effect. So women who are premenopausal before the age of 55, their LDL levels are slightly lower than men. So थोड़ा सा जो protective effect है, वो फिर वो after menopause, after the age of 55 roughly, then वो चला जाता है. So then again, women then should again be testing, and they should be testing regardless, but that sort of protection is there during those sort of premenopausal years. And so that is the main difference basically.
Okay.
But ultimately there is no substitute for screening, so
and that is so inevitable. I mean, you have to do it. तो कभी भी कोई हार्ट अटैक पेशेंट या कोई भी हार्ट सिम्टम लेके डॉक्टर के पास आता है, सो आई हैव सीन दैट सबसे पहले दे स्टार्ट विद टेकिंग हिस्ट्री कि फैमिली में किसी को हार्ट अटैक हुआ है या नहीं हुआ है
जी.
सो इन दिस केस कितना इम्पोर्टेंट है कि अगर किसी भी फैमिली मेम्बर को हार्ट अटैक अगर हुआ है तो आपने अपनी स्क्रीनिंग जल्दी चालू कर देनी चाहिए. और कैसे हम ये encourage भी करें कि family people start talking about your heart health and then encourage each other to get the screening done yearly.
Absolutely right. आपने बिल्कुल सही कहा है. Basically मेरे क्लिनिक में पेशेंट्स आते हैं, unfortunately they've had a heart attack for example, and then उनके जो बच्चे हैं, they may have children in their 20s or 30s, तो they then feel a sudden jolt. एक दिन ठीक थे पापा या मम्मी, and the next day they went through such a event. तो फिर वो अपना जो रिपोर्ट्स ले आते हैं, and तो ये जो then that the process then starts in the family. So the same thing, मैं ये कहता हूँ कि ये हम उस इवेंट के लिए वेट नहीं करना चाहिए. As a family we should be having, we have lots of dinner table conversations. So once in a while we should also have a slight 5 to 10 minute conversation on health. चलो हम लोग किसने रिपोर्ट कराया नहीं कराया, हमने चेक किया कि नहीं किया, as a sort of check one for the other. We ask our parents ask us, or we ask our siblings, etc. Come se come, then at least there is a sort of check within the family.
Yes.
And at the same time there is a sort of very healthy looking after each other approach, in the sense that chalo hum log kar liya hai, but are we now doing the thing that is needed to reduce, let's say,
correct,
two members of the family cholesterol level high hai, so then the other members also feel कि चलो उनका high है, दवाई ले रहे हैं कि नहीं ले रहे हैं, दोबारा जाके exercise, so then एक sort of a health conscious environment जो है वो family में आ जाता है, and that is priceless, because that is where prevention starts.
Exactly. And also I want to put some light on how much bad is smoking and alcohol which increase the risk of heart attack and as well increase the cholesterol levels.
Yes, so smoking is an absolute no-no. Smoking is probably the worst thing that we can do to our bodies. It increases the risk of heart attacks. It's basically like a pro-inflammatory state is created, in the sort of blood vessels, etc. So it increases cardiovascular risk. It has got various other side effects such as lung cancer, etc., which I'm not going to go into, and then overall sort of makes the body prone to developing these cardiovascular events. And then excess alcohol again leads to high triglycerides and overall high cholesterol levels. Then so again, alcohol should be in moderation. There are prescribed WHO के जो units हैं per week. If somebody does consume alcohol, it should be completely well within those recommended limits. As for men, and the same for women, and that prevention is absolutely key.
And there are no benefits of taking red wine to keep your heart healthy. People are promoting it.
Yes, the people are promoting lots of things. So we have to basically ultimately the numbers speak for themselves.
That is true.
So you, as long as you're keeping your units of alcohol intake within the recommended
right.
limits as defined by the guidelines or as prescribed by the various societies, and as long as we are keeping our sort of levels of cholesterol, lipid profile, etc., and other parameters, blood, biochemical parameters in check, that is what's needed. Sort of 2 glasses or whatever is a secondary thing.
That is right. That is
Yes.
right. Yeah. So, any important message that you want to give to our viewers?
Well, I would like to thank you, Dr. Chetna, and thank Mankind and all, all the lovely people associated with that, including all of you who've helped today in bringing out this podcast. India is growing by leaps and bounds. We are becoming, a more wealthier nation by the day. Our GDP is increasing. The whole world is looking to us. We are a young country. A lot of young people, and that's where the double whammy is. So we have a high risk of cardiovascular disease. We have South Asian genetics, heritage, by virtue of which we are at a higher risk for developing cardiovascular disease. So people talk about this demographic dividend.
Yes.
The demographic dividend is there when the demographic is there.
Correct.
No person, no dividend, right? So it is now increasingly our responsibility towards us, towards our families, perhaps towards society, because healthcare in India is so expensive. Not everybody has lakhs and lakhs of rupees to pay for. And why would you want to pay that for a hospitalization? Why don't you go for holiday somewhere?
True. This is like a good message.
Yes. So prevention is key. If we fall ill with heart disease today, we pay a big price. That price may be with morbidity, with our health. It may be with financially, lack of then lost opportunity at work, etc., etc. So this young population has to look after it.
Yes.
And to look after it, it has to not firefight, it has to stop that spark.
Correct.
So the cholesterol, because आज हम cholesterol के ऊपर बोल रहे हैं, the single most important message for us is that to continue as healthy, as healthy people, overall to reduce the burden of disease on society, and to make our lives, more healthier, please get your lipid profile done. If you've got it done, that's fantastic. You should give yourself a pat on the back and keep doing it at regular intervals in the future. If you haven't done it, please do it at the next available opportunity. अगर आपने किया है, तो please act on it. Please see your general practitioner or your specialist, whoever it may be, who can evaluate the result for you and give you the lifestyle advice and perhaps medication advice as well if needed, depending on the levels. And once you have done that, also look around you at your friends, your family, people who matter to you, and spread the message to them.
Yes.
That this is a collective, this is a public health space basically.
Right.
We are in a sort of tertiary quaternary care hospital seeing a heart attack patient. That is just like sort of the tip of the iceberg.
True.
We are in a public health space, so the more we increase the awareness, check our lipid levels, take the medication, take the lifestyle advice, this overall is going to help reduce the burden of cardiovascular disease, and then overall will have tremendous not only health but also societal benefit. So please measure your fasting lipid profile, have a lipid profile done, please get your cholesterol measured. I could not emphasize it more.
There's this segment, like a fun segment that we'll do, which is rapid fire round, and I have few questions for you, and you have to maybe answer it very quickly or briefly.
Sure.
Alright, so let's just start. Are you ready for it?
Yes, I'm good to go.
So first one is one major misconception about cholesterol that needs to go.
That if you're thin, that your cholesterol is going to be fine.
Right.
I think or put it the other way, that only people who are obese have high cholesterol levels. No, that is completely a fallacy. Yeah.
Good one. Next one is LDL versus HDL. If you could give them a one-word description, what it would be?
So LDL is bad cholesterol because it accumulates in the walls of the arteries, causing heart attacks, strokes, etc. HDL is good cholesterol. So HDL good, LDL
Bad.
bad. We want LDL levels to be low and HDL levels to be high.
Okay. The most underrated habit for a heart healthy life.
Screening. I think not checking our parameters. Let's say, for example, given what we've been discussing, the lipid profile,
Understood. Okay. At what age should someone start getting their lipid profile checked?
as soon as possible. As soon as possible. I'm not saying as whilst being a baby, but once they should have their, even if they're in their early adulthood, they should have it checked.
One food people think is bad for cholesterol, but it isn't.
I think for those who are non-vegetarians, eggs, for example, so a large egg has not a lot of saturated fat,
Yes, right.
but it also has some good sort of effects on health.
Yes.
So one large egg a day is probably has 1.5 grams of saturated fat, I think, roughly. So that should be fine, for those who eat eggs.
Correct. What is worse, high LDL or low HDL?
Any day it's high LDL, because LDL is bad cholesterol, and that's the one we want to be low rather than high.
Okay. One red flag in routine checkups that people tend to ignore.
I would say high cholesterol levels.
Okay.
So absolutely important to further investigate that. Especially when it's not just the total cholesterol level, but all the different individual components that need to be seen.
So statins or lifestyle changes, which comes first?
Lifestyle changes definitely, but statins, I would say, need to be considered very seriously. Depending again on the risk profile of the patient.
The biggest mistake people make when trying to lower cholesterol.
I think adherence to drug therapy, if prescribed.
Right, right.
I think because it's, like you say, a silent killer,
Yes.
it has got no effects, no signs or symptoms. It has got effects, apologize, but doesn't have signs or symptoms. So they think that, dawai kha ke hoga kya,
Right, they don't take it seriously.
But the whole point is to prevent that event.
So if you could give one piece of advice for better heart health, what would it be?
Get your lipid profile, cholesterol checked.
Thank you so much for being a part of this. And
privilege is mine, honor is mine, and thank you very much for this lovely podcast. And I hope that we all take away.
Please remember, prevention is the key. With regular screening, lifestyle changes, and right choice of treatment, it makes all the difference. So let's just not celebrate April Fool's Day with pranks, but let's make a reminder to be wise about our health. Because when it comes to heart health, low is better. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more such health discussion on various health topics. Until then, stay informed, stay healthy.